Welcome to All Things Cardio-Oncology. This is the podcast of the International Cardio-Oncology Society. My name is Steve Caselli, and I'm the Executive Director of ICOS. It's my pleasure to again introduce my co-host for this year's series, Dr. Arjun Ghosh. Arjun is consultant cardiologist at Bart's Heart Center and University College London Hospital. He's also the clinical lead of the Cardio-Oncology service at University College London Hospital. So I hope I got all that right. Arjun, welcome again.
Thanks so much, Steve, for having me, and really looking forward to this episode.
Well, we are very excited today to have with us Alison, Macklin, and Anecita, Fadol. These are cardio-oncology nurses, and they are here to enlighten us about the vital role that nurses play in the care of cardio-oncology patients. I was speaking with a physician earlier this year, and he said, we all know that it's the nurses who are closest to the patients, and they're the ones who provide much of the real care for them. And I really appreciated that admission, and I think it's just absolutely true. And so we are thrilled to have both of you with us today. And I want to begin by just having each of you introduce yourself, tell us a little bit about your background and how you got involved in cardio-oncology and where you're serving now. So Alison, maybe you can begin.
Okay, thank you. Well, thank you very much for inviting me to speak today. It's really great, thank you. So my name is Alison Macklin. I work at University College Hospital, which is in central London in the UK. And I work as a cardio-oncology specialist nurse and research nurse, which I have been doing for around 3.5 years now.
Wonderful. Thanks, Alison. Anecita, tell us a little bit about where you are and your background.
Hi, my name is Anecita Fadol, and thank you all so much for inviting me to this podcast. I'm a nurse practitioner, and I work here at MD Anderson Cancer Center in Houston, Texas, and I have been working here in cardio-oncology practice for last 20 years. My background purely is in cardiology, and I used to manage a heart failure program at an outside managed care system. And when I started here in MD Anderson, that's when I started the cardio-oncology practice. At the same time, I'm also a faculty as an associate professor, both in the departments of nursing and the department of cardiology here at MD Anderson.
Terrific. Alison, can you tell us just briefly, how did you get interested in cardio-oncology?
So I have a background in critical care nursing, which I've done for a number of years. Our hospital is quite a cancer-based hospital, and I moved into research in critical care. So alongside that, my projects were just coming to an end, and I saw an advert for a cardio-oncology research post, and it was so interesting looking at protecting the heart for patients undergoing cancer treatment. So I sort of came in slightly sideways, took up a research position, and they were just setting up the cardio-oncology service whilst I was doing this, and I started. I was asked if I could also take on a CNS role to go alongside that. So that's how I got involved.
Interesting. And Anecita, what about you? How did you get involved in cardio-oncology?
Yeah, all my life I have been a cardiology, cardiovascular nurse. I started my nursing career as a staff nurse at the cardiovascular intensive care unit at the Methodist Hospital here in the medical center. And then I went through the ranks, I became a clinical nurse specialist, coordinated a critical care residency program. And later on, when I became a nurse practitioner, as I mentioned earlier, I was coordinating the heart failure program at Kelsey-Seybold Clinic. At that time, there was a conference here at MD Anderson, and I noted that there's a lot of patients who have these heart failure issues, which I didn't realize then. So when the cardio-oncology department opened here at MD Anderson, I was invited, to join them. And so from then on, I have stayed in here and I've enjoyed, the practice.
That's great. Thank you both for sharing that.
Thanks, Steve, and very nice introductions both. So we have a very good understanding of why you both started in cardio-oncology. And I think I'll follow on from that theme. How should other nurses get into cardio-oncology? There may be a feeling that they need a cardiology background or an oncology background, but I guess as Alison has shown that that's not necessarily the case. Maybe Anecita, if I could start with you, how can other nurses get into cardio-oncology nursing?
Yeah, thank you for asking that question, because, you know, like I've been asked that question many times by nurses who are wanting to go into cardio-oncology. So currently, there are no formal training programs for nurses interested to enter into cardio-oncology nursing practice. Nurses learn cardio-oncology by on-the-job training because of the clinical area they were hired into. And the example I'm alluding to is like here at MD Anderson, this is a cancer center and nurses have expertise in oncology, but they are caring for the cardiovascular issues of patients being treated for cancer. Hence, they're in the practice of cardio-oncology specialty. So nurses who are interested, you know, and that's great that Alison has an oncology background and get into this specialty. Then you have the other side of the specialty, meaning that's the expertise in that specialty. So if you have a cardiology background like me, entry into cardio-oncology is like you have to just learn on your own, you know, meaning on the job training as of now, because, you know, we don't have formal training programs. But, you know, for nurses who are interested, you know, with oncology background and would like to practice in the cardio-oncology setting, there are some available resources to improve their knowledge. Like, for example, attending conferences like the ICOS annual conference, the Oncology Nursing Society Congress Conference, the American College of Cardiology, ACC, Cardio-Oncology meeting, which is done every year. They can also access websites such as the ASCO, the American College of Cardiology, as well as, you know, like, yeah, the Heart Failure Society. There's some areas there now that's talking about, you know, like, yeah, the cardio-oncology issues. So, you know, at this point, it's like learning on the job, shall I say.
Sure.
And it is encouraged if you are either backgrounds, you can learn it.
Sure, that's great to know. And Alison, yours was a bit of an unconventional entry into cardio-oncology via, you know, critical care and ITU. How you know, can other nurses, you know, get into cardio-oncology? And I suppose you could say yourself that you don't necessarily need a cardiology or an oncology background. I mean, what are your thoughts on this?
Yeah, I mean, I definitely think it would be useful if you did have cardiology or oncology. But as Anecita says, you very definitely do learn on the job. There's no formal qualification to be a cardio-oncology specialist nurse. So I think as long as you're dynamic, you're committed, you really want to make a difference, I think anyone could go forward, as long as you have passion for the subject. So I don't think it should hold you back.
Great. Okay. And Alison, what were the main challenges that you faced after you started? So the initial challenges, would you say?
So I think there's lots of abbreviations in cancer treatment. So chemotherapies and such like. I was often Googling in the first instance just to become more familiarized with some of the regimes. It's a very fast-paced environment as well. So I did find that quite challenging. Lots of different side effects to learn and become more familiar with, and things are changing all the time. So I think those have been the most challenging things for me.
Okay, and Anecita, the same question to you. What were the initial challenges that you faced?
Yeah, my initial challenge when I started as a nurse practitioner in cardio-oncology is, you know, I feel inadequate in my knowledge in oncology. I have to study the different types of chemotherapies. You know, I mean, I used to keep a cheat sheet in my pocket as to those acronyms like RCHOP.
Yeah.
Right,
Absolutely agree.
What do they mean? because they speak a different language than cardiology.
Yeah.
So I have to keep that in my pocket for a while. And the more I've been into practice, I get familiar to those potentially cardiotoxic cancer treatments. And you just add up, like more knowledge as you go through the advances in cancer, like immunotherapy right now, myocarditis. So it gets better through the years. So whoever is interested in it, don't get discouraged. The challenge will get better.
Sure,
absolutely.
Sure. And Anecita, if I could ask you, if somebody were to ask, if a nurse were to ask, what is your day job? What is it that you actually do on the job in cardio-oncology? What would you say?
Yeah, my day job in cardio-oncology, like my role as a nurse practitioner, I always think of myself first as I'm a caring part of the patient versus, like as faculty, I'm involved in research also. But my job is just like today, like I am a nurse practitioner. I have my own set of patients in the clinic, separate from the physicians. And I follow these patients and manage their care in terms of the cardiovascular issues. An example is like providing pre-chemo evaluation. Today I have a patient that's going for surgery, hypertension, patients with heart failure, all those problems of cardio-oncology that we follow in the clinic.
Okay, and apart from your clinic duties, do you also, are you involved in the inpatient management of these patients?
The nurse practitioners are involved in the inpatient management, but since I started as a faculty and I was involved in research, then I focus more in the outpatient setting. And then my job, including the education of nurses, doing some research. And so, like in the inpatient, I participate in the morning rounds every day. So I will keep myself abreast with what's going on in the inpatient.
Sure, sure. And Alison, is it different for you in the UK compared to Anecita?
Well, my role is specialist nurse and research nurse, so I have two components to my role. It's a developing role. We do a lot of communication, collaborative links between different teams, very multidisciplinary approach. We coordinate the complex care needs of our patients by triaging referrals and organising investigations and ongoing tests. We are acting as point of contact for patient staff, and we assess for symptoms, promote evidence-based care, and service evaluation. So we do lots of things. Yeah.
Sure, that sounds like a lot, and I know it is, having worked with you on a day-to-day basis.
Yes.
And from the research side, Alison, what is your role as a cardio-oncology research nurse?
So I coordinate a couple of studies which we have ongoing. I'm really lucky to be involved in that. So I really feel like we're looking to improve care on how we do things and better understand patients who are going through cancer treatments and cardiovascular complications. So coordinating our research, patients consenting, that type of thing, and ongoing follow-ups.
Sure. And Anecita, you're heavily involved in research as an investigator. So how is your research work, and what are you involved with?
Yes, in that my research role is as part of my role as a faculty. And I have a dual appointment in the Department of Nursing and Cardiology. So I'm involved in research as a primary investigator and as a collaborator for different research trials. One of the research project that I've done is the development and validation of the MD Anderson Symptom Inventory Heart Failure Instrument, which is used to monitor the symptoms in patients with heart failure and cancer. This instrument has been translated in Chinese and Spanish, and we use this instrument right now mostly for clinical trials, but it is also used for clinical practice. As an extension or continuation of that research, I used that Medasi HF instrument in doing symptom monitoring when following up patients after their discharge from the hospital. So this trial, initially we did the interactive voice response system, wherein the patient gets a pre-recorded phone call assessing their symptoms and they can respond. However, after a period of time, because it's time consuming for nurses to follow through with a large number of patients, we are progressing this into a different kind of symptom monitoring, wherein there is a central number where patients can call. So another part of research that I'm involved in, and this is in collaboration with the cardiology group, is in the starting an exercise group for patients with heart failure. And currently, in collaboration with the Department of Symptoms Research and Cardiology, we are doing a systematic literature review for a referral criteria for cancer patients with heart failure. Because as I've noted, patients in oncology are very established in referring patients to palliative or supportive care. However, in end-stage heart failure or in patients with both heart failure and cancer, there's no criteria, and the oncologists are the ones referring it. So we have finished the systematic literature review, and the next step is to do a Delphi study and involve, the Cardio-Oncology group to identify those criteria, and probably we can validate them in terms of what are the things that we need to use to trigger a referral to the supportive care.
Sure. So I guess from both of your roles, both Alison and Anecita, I think it's very clear that for cardio-oncology nurses, there is very much, the opportunities to do something on the clinical side, but also very much the opportunities on the research side. So what is the most challenging part of the job then, given that, you have these dual roles on both the clinical and the research side? I mean, Alison, if I could maybe start with you on this one.
I think juggling everything, it's very fast paced, as I said, lots of things going on, making sure that we're not delaying any treatments. So yeah, it's just a very fast-paced environment. So it's making sure that your time management is particularly good and keeping up with everything that's going on. I find that sometimes quite challenging. We sometimes refer for cardiac investigations at different hospitals. So it's just the complex coordination that's sometimes a challenge for me, I would definitely say. Lots of different routes of communication as well, via email, and we have hospital systems, letters, various things like that. So it's keeping on top of everything.
Great, okay. And Anecita, what would you say is the most challenging part of your job?
I think the most challenging part of my job is because, it seems like the job, this is the role of faculty here for a nurse practitioner, is something new. So getting into that role and, combining both clinical and patient education and nurses, it's like it's multitasking. But for me, the most challenging part is when I'm in clinical, when the patient is very complex with multiple cardiovascular issues, and you have to coordinate all the multiple services that's involved in the management of the patient. For example, just today we have a patient with metastatic colorectal cancer that needs urgent cancer treatment, 5-FU, which can cause coronary artery vasospasm. Patient has cardiomyopathy with an LVEF of 31%. And moderate to severe coronary artery disease, experiencing chest pain. So oncology will not start that medication because of the CAD, but the patient needs the medication because of his metastatic cancer growing fast. And the patient is so upset that, it's not done fast enough. So it's challenging. You do your best, but you should learn how to multitask.
Sure. And what's the most rewarding? I mean, I guess maybe Anecita, you've kind of mentioned it yourself, that if you're able to kind of comfort the patients in these situations, that's a great role. But I mean, what would you say is the most rewarding part of your job?
I think for me now, having practiced in this field for some time, the most rewarding is when a complex patient, similar to that, which I have cared for previously, is able to receive the prescribed cancer care safely without cardiac events. And in the end, the patient becomes a survivor and they come to you and they're so thankful, for the care that they have received. And these patients, because they're chronic, they come to the clinic, on the survivorship clinic, on a regular basis. And it's like they become part of your family. And, it's a good feeling.
Yes, I suppose then you've touched on something that a lot of people listening to this might think that, you only see the patients when they're unwell with the cancer, and once they're treated, you wouldn't see them again. But as you say, that in the late effects clinic, you may be following these patients up for many years, and you can develop, very nice relationships with these patients and their family members. Alison, what's the most rewarding part of the job for you?
Yeah, I would agree with Anecita. It's when you support patients through very challenging times of their life, and you know that you've really made a difference to their treatment or their prognosis, or you're improving care. I find that really rewarding, that you've really made the difference.
Okay. So I think you're both trailblazers in this new field of cardio-oncology nursing. So if I were to ask you, how do you think you can progress this field? Is it, you've touched upon, both of you, that there are no training courses specific for nurses, there are no necessarily books or exams for nurses or certifications. I mean, is this something that should be addressed? I mean, maybe Anecita, if I could start with you.
I think, it should be addressed. When I look at medicine, you have progress ahead of nursing. You have your fellowship in cardio-oncology. There's a certification right now, and nurses can take it too. And from the nursing standpoint, because nursing is a big part of the cardio-oncology practice, as mentioned, it is like, I've said it before, that cardio-oncology nurses serve as the bridge between cardiologists, oncologists, and the interprofessional team. So nurses should have the adequate training to be able to function effectively. Now, in terms of the books, yes, we need to have a resource book. Actually, like a few years ago, I was asked by the Oncology Nursing Society to edit a book for the cardiac complications of cancer therapy. It needs to be updated, but then that book is written like a nursing process, with as a easy reference for nursing. Okay. And it talks about the basic problems and what we need to do, what are the basic interventions, side effects of drugs, and all that. So I think that's one. We need to maybe we need a new edition of that, or a new pocketbook or guidelines for nursing that they can easily refer to. Next is, in terms of education, we need to have something similar to what physicians are doing, wherein there'll be a formal training for nurses who are interested. Right now, actually, I'm collaborating with the University of Texas Health Science Center here in Houston to develop a post-APN cardio-oncology specialty. But we are just in the beginning developing the curriculum, and it may take probably another 6 months to a year to have that approved. And so I believe that, because this is an evolving specialty where there is a great need for it, as we see the survivorship increase in numbers, then, we in nursing should have these special training or move into developing formal education, as well as, references and training for nurses interested in this specialty.
Great. So a lot of really fantastic ideas there, Anecita, and maybe one for Steve to have a think about. An ICOS nursing cardio-oncology manual might be the next publication from the ICOS stable. What about you, Alison? How do you think that we can progress the field of cardio-oncology nursing?
Yeah, I would agree. There isn't in the UK any formal kind of training for cardio-oncology nursing. I've been very lucky. Like I've spent a lot of time with our heart failure colleagues, and rehab team and various colleagues at our institution. But yeah, it would be really great to have some kind of formal training available to nurses. Obviously, we all lead by example to promote our specialty and do local study days and such like, but to have a formal training would be really great for people who are interested in being involved.
Alison, I know that you have been involved in our nurses working group and some of the webinars we're doing there. What have you benefited from there?
I think as well, because we're all separated and we all do different things according to what our service demands. So it's really nice, the nursing group, to all listen to what other people are up to, and then you can get inspiration on how you can move your role forward and improve your service. So it's really great to be a part of that.
And Arjun, I know that you are involved in a national training course. Maybe tell us just briefly about that as well. That's another great opportunity.
The national course that I run, that is actually multidisciplinary, and that is aimed at doctors, nurses, trainees, physiologists, pharmacists, even primary care physicians, anyone who looks after cancer patients with cardiac issues. And we've had nurses speak at each of those courses every year. And it is very much open to all, and that is the ethos of the course. So that is the formal kind of bit of nursing education, but it's not specifically for nurses. It's aimed for everyone, and there's good attendance from oncology and cardiology nurses.
That sounds amazing. Do you have to get us information on that so we can promote it to our community?
Yeah, and the next one is November the 18th. And it was, it's online as well. It's a hybrid. I mean, this year it will be online again, so anyone can join from around the world. To finish off, if I could ask the last question to both of you. If you had to give an elevator pitch to a nurse, just to say, why is cardio-oncology nursing such a fantastic career option? What would you say, Alison?
I would just say it's just a great opportunity. You can really make a difference, and you should just go for it, because there's just so much great stuff going on. There's lots of things changing and moving and progressing, and it's just such an exciting field to be in, and I'm really enjoying being a part of it.
Okay, that's a great advert for cardio-oncology. And Anecita, if I were to ask you the same question, how best would you entice nurses to join this fantastic cardio-oncology nursing profession?
I think, first of all, the cardio-oncology nurses so far that I have met, with ICOS, are as enthusiastic as Alison, and that is a good marketing tool, that these nurses who are involved with the specialty are excited, and they are really enthusiastic in what they're doing. And I will tell these new nurses or nurses thinking into going into cardio-oncology that this specialty is just in its infancy for nursing anyway, and to move forward, this is a great area to be in, and you will never have a problem with looking for a job because of the increasing survivorship, increasing treatments in cancer, and as patients grow older, they may develop cardiovascular issues. So it is always an evolving specialty, and it's not boring. You'll always have challenges, and it's in the end result would give you good satisfaction in terms of professional commitment.
Great. I think that's a fantastic way to really advertise cardio-oncology nursing, and to end the questions from my side. I'll hand back over to you, Steve.
Well, thank you both so much for not only educating us, but really inspiring us. It's obvious you both really love the work that you're doing. So this is super helpful. And I just so appreciate both of you, your emphasis on really caring for these patients personally, and getting to know them over the long haul and providing, the best possible care for them. That's ultimately what we're all about. There's obviously a gap, in need for training and education, and we're trying to do our small bit in order to address that. We're, as part of our weekly webinar series, Anecita has been a part of this. We're doing 4 weeks on cardio-oncology nursing. So I'd love to have any of our listeners jump in and join our weekly webinars. You can find out information about that and our other activities at our website, ic-os.org. And just one other note, it's hard to believe it's already time to start announcing this, but our Global Cardio-Oncology Summit will be taking place as a virtual event this year again, and it'll be September 30th through October 1st. Registration is open, and you can find information about that on our website as well. So thank you both again for your time. Thank you for joining us as we discuss all things cardio-oncology.